Hi, I'm Dr. Kathleen Coates at Coates Hearing Clinic. Today I'm going to talk to you about some communication strategies that you can use. This is for anyone who may experience hearing loss as well as your loved ones or your communication partners. These are going to be some general communication strategies, but also some strategies to use in very complex hearing environments. Hearing aids are not always a quick fix. Some types of hearing loss require a little bit of extra effort on the patient's part to be able to understand what people say. So this is part of the process, an important part. Our goal as your provider, as your audiologist, is to educate you as well as your family members or your friends or your communication partners on the best way to communicate. Communication is a two-way street, so we do want to make sure that you understand how to use these strategies, but also your loved ones as well. We want you to be involved in the conversation. We want you to be part of the conversation. We don't want you to feel like you're having to sit back or nod your head or just not feel engaged or isolated from social environments. So these strategies can help along with hearing aids when you have hearing loss. Self-advocacy and patience, these are definitely easier said than done. It does take quite a bit of effort on the patient's part as well as their family members and friends, but to be able to say, I have hearing loss, I'm sorry I didn't understand what you were saying, here's the best way to communicate with me, or here's some resources for your family members and friends. We're oftentimes providing that in the office, but it does take a little bit of that self-advocacy to be able to stand up for yourself and to say, I need a little bit of extra time or a little bit of repetition, that sort of thing. Patience as well, this comes from both sides, so not just getting frustrated after the first time you repeat something, but to understand how hearing loss works and why it's important for the patient to take a little extra time to process what's being said. So there's so many different ways that you can communicate differently, but it does take time and practice, so having that patience is very important. The first communication strategy is gaining attention. So this is really important to not only get the attention of the person that you're trying to talk to, that way they can focus on what you're trying to say. So the ways that you can do this is you can say his or her name, you can tap their shoulder or arm lightly to walk in front of them, to be in their sight. So getting attention first is really important, not only for anyone with any degree of hearing loss and any communication, even if you have normal hearing. Getting attention first to be able to just face each other and have a conversation is going to be easier than just saying something and then their focus is somewhere else, like on the television or they're in a different room, that sort of thing. So getting attention is really important. Next up, visual cues and lip reading. So for a lot of patients who do experience hearing loss, a lot of people don't understand or don't realize that they're relying a lot on visual cues and lip reading to fill in what they miss. So definitely after you gain their attention, you face them or come in the same room, this is going to be really important and really beneficial for communication. So making sure that you're not talking, with your hand in front of your face, they have a clear sight of your face and your lips. Next up, speaking clearly. I think it's a common misconception that when you're talking to somebody who does experience hearing loss that you need to talk louder. Now for some that works okay, but for the majority of hearing loss, it is easier to understand what people say when they talk more crisp and clear and not just louder. So trying to just speak a little bit more distinctly is really helpful. And then also speaking at a normal rate, don't talk too fast or too slow. Just talk kind of at a normal level. Rephrasing, this one is important as well. So a lot of people are in the habit of, if you don't understand what somebody says, you just ask them to repeat, and then the other person will just repeat exactly what they said the second time, and then it causes frustration because there could have been something in that sentence that the patient just didn't understand, or parts of it that were not able to be heard. So it's easier for the patient to understand what you're saying if you can figure out a way to rephrase it instead of repeat it. So rephrasing can be just changing certain words in the sentence. It can be adding more information to it. It can be changing, just the way that you say it. So rephrasing it in a different way is really helpful. Now, for the patient side, the one that has the hearing loss, I think the habit is to just say what when you don't understand, but to try to practice more of, okay, what part of that sentence did I hear? So, oh, you said something about so-and-so's house. What did you say about their house? Rather than just saying what. That way, the other person won't have to repeat everything that's said, but just fill in what you missed. So this part does take quite a bit of practice, quite a bit of effort, but once you get in the habit of it, it just comes natural. Background noise. So a lot of our patients who have hearing loss really struggle to hear when there's competing noise. Situations where you're in a restaurant, group settings, church, anywhere where there's background noise. So if at all possible, when you're trying to have a conversation, especially an important one, move to an area that is a little bit more quiet. That is always going to be helpful, no matter what degree of hearing loss you have. Even if you have completely normal hearing, moving to a quieter area is always easier. Hearing aid technology advancements, I wanted to touch on this as well. There have been a lot of changes in the hearing aids to be able to help with day-to-day communication. For example, most of the settings are automatic now, so everywhere that you go, no matter what situation that you're in, they're automatically adjusting based on what kind of sound is going through the microphones. But this does take quite a bit of fine-tuning, programming adjustments, especially at the beginning with hearing aids, to get them just right for you in the environments that you're in specifically. So your audiologist will go through this with you. If you're ever curious if there's other changes that can be made to help with day-to-day communication, definitely call and we'll take a look at the programming. Microphone directionality, this is another one that's really important, especially for situations where there is background noise. So for example, the way that the hearing aid technology is set up is to focus in on kind of where you're looking, where your focus is. If you think about the natural acoustics of your ear, they funnel in sound from the front the best. So the hearing aids kind of mimic that technology where it's following you everywhere you're looking. This is important to understand when you're wearing hearing aids because to best utilize this, you may have to position yourself in a certain environment to best use this technology. So for example, in a restaurant, the arrow is pointing to this man because he's kind of in an ideal seat in this environment. When you have the option to maybe ask for a certain place to sit and that sort of thing. So in a restaurant like this where it's very busy, lots of background noise, the patient who wears hearing aids, it's better if they position themselves with as much background noise behind them that they can, because the front microphones are focused more on where they're looking and the back microphones are trying to filter out some of the background noise and turn it down behind you. So as much of the background noise there that you can put behind you, that's going to be easier to communicate. And then sitting close to the ones that you're with, sitting off to the side, maybe in a booth, somewhere where it's a little bit more quiet. And this person specifically is facing the window. So his front microphones are focused more on just a few people in front of him and not the whole restaurant. Mask hearing, of course, this comes up still sometimes when someone's wearing a mask. Of course, it's always harder when you don't have those visual cues or lip reading. So if you can ask the person to remove their mask just for a second if you don't quite understand what they're saying, and you could kind of have a pen and paper ready or something like that to fill in what they missed. But there's some other technologies that will help with this as well. For example, there is a free app called Live Transcribe. So if you're out somewhere and you have a certain type of hearing loss where even with the hearing aids you can't understand what people are saying, we also recommend this for our cochlear implant patients. So it reads out live what people are saying. So if you're out somewhere, the grocery store, a doctor's appointment, somewhere like that where you're not understanding what people are saying, this will be very helpful for you. So you can pull it up, it will read out what they're saying so that you can read it, and that way you can best communicate in maybe a challenging environment like that. There's some other caption phones and things like that to best communicate on the phone. So if you're ever curious about how that might work with your type of hearing loss in your home, give us a call and we'll let you know and get you those resources as well. There's been some app advancements as well. So a lot of patients that wear hearing aids have the option of a free app. Again, most of the settings are automatic. We don't want the patient to have to go into an app and change settings through the day, but there are some patients who could benefit from this. For example, that microphone directionality we talked about, there's ways for the patient to manually adjust this within the app as well as their volume control. It's just a better visual or another tool that patients can use to be able to adjust their hearing aids manually if needed. There's also additional accessories as well that some patients require even if they wear hearing aids that will help them hear in a very challenging environment to best communicate in those types of settings. One example, one of the most popular accessories that have been very helpful and beneficial for patients is called a remote microphone. So it's used for their communication partner to wear. Their voice is going directly into this microphone. Their voice is going directly into the microphone, as you can see in that picture, the way that that man's wearing it. Their voice goes directly into the hearing aids of the patient. So it blocks out a lot of background noise and can be very helpful. Of course, always be patient, be kind, and practice these strategies. It's not something that comes easy, but over time, as you make this a habit, make this part of your day-to-day communication, it becomes easier and easier once you recognize the difficulties that a patient with hearing loss might experience. Of course, we're always here for you to provide you some more resources if you need it.